All right, everybody, welcome and hello. We're going to give it another minute or two as people are joining and settling in for our webinar today. My name is Yenny. I am the founder and CEO here at Kari Prehab, and we are hosting this webinar in collaboration with the Bone Health and Osteoporosis Foundation because October is World Osteoporosis Day, and we actually really love to put together these sessions to provide evidence-based and tangible information for our community so that you can learn some trustworthy, reliable, research-backed techniques to improve your bone density via exercise. And if you got here a little bit early, then you'll have seen that we had a screen share up of a slide with a statistic from the Bone Health and Osteoporosis Foundation, where their polling has found that 64% of people who ask for exercise guidance from their doctors do not receive any exercise guidance. 64% are not able to receive exercise guidance. And our own polling actually totally confirms this. We will be asking you about this a little bit in a few moments down the line because we want to hear what your experience has been. But when we poll our own webinar audiences, up to 80% say that they were not able to get exercise guidance from their doctor. And this is actually quite shocking because strength training and impact training are very heavily, extremely well-researched areas, and they have consistently been found to be safe and effective bone density interventions. So we feel that these are options that should be available and readily accessible if people want to kind of put together their more own individualized treatment protocol, which, depending on your personal preferences and your situation, may or may not involve pharmaceuticals. So exercise is a great complement or alternative to pharmaceuticals. Now, I'm guessing that many of you are here today because you're interested in educating yourselves about the options that are available to you. So we're really glad to have you join us. Thank you for taking time out of your Saturday to come and spend a little bit of time with us here. One of the things that we most often hear from our clients in our program is that it felt incredibly disempowering when they were not able to receive evidence-based guidance on how to exercise for bone density. So I want to add to that everything that you're going to hear in this webinar is based on research. So we are not stating our own opinions or with any bias or specific angle, although we, of course, are huge fans of exercising in general. But everything that you're going to hear today is from the research. It's completely evidence-based and backed by studies that are out there. I'm really excited in a moment to introduce our speaker, Michaela, who is going to guide us through today's session. And before we do that, I wanted to go over a couple of quick logistics for how the session is going to run today. It goes without saying that the information we're providing here is general in nature and it does not constitute medical advice. So if you're at all unsure about what's suitable or appropriate for you, we always recommend speaking with your doctor or your treating physician. Our goal, though, is to offer some actionable takeaways that you can implement into your own wellness and bone health routine right away. Again, knowing that this is information that is backed by research and subsequently is trustworthy as well. You can put questions into the Q&A at any time during the session. I'll be monitoring that as Michaela is speaking. So if you have logistical questions, I will answer those right away. But we're also going to have lots of time for interactive Q&A at the end of the session. So the really kind of juicy, interesting questions that will be useful for everybody to hear the answers to, we will leave for later so we can discuss them together during that Q&A. We'll send out a replay of this webinar to everybody that was registered, and you're going to get that probably as early as this afternoon, and if not, definitely tomorrow. So just be on the lookout for that email from us afterwards. So without any further ado, I'm really excited to introduce Michaela Smith. She is our Osteoporosis Program Director here at Kari Prehab. She is a yoga medicine therapeutic specialist, a Bone Fit and NASM certified personal trainer, and she's also a nutritional therapy practitioner. She has a background in nutrition and dietetics with a degree from Bastyr University on the topic. So she brings an extremely well-rounded and comprehensive, holistic viewpoint when it comes to bone density and menopausal health in general. Thank you so much for being here, Michaela. Feel free to take it away.
Awesome. Thank you for having me. I'm so excited to share about some techniques and tips for bone density. So I'm just going to share my screen here. And that looks okay.
That's great. Thanks.
Awesome. Okay, so today we're covering non-negotiable exercise techniques for better bone mineral density and bone health in general. So we're also going to talk about fall and fracture prevention a little bit towards the end. So just starting off here with some basics, what is osteoporosis? I'm sure if you're at this webinar, you really don't need me to go into detail on this one, but I do like to cover this so that we all have a nice common language to talk about the subject. So osteoporosis is a medical condition that causes the bones to become weak, brittle, and porous, and that makes them prone to breaking or susceptible to fractures. And this occurs either when the body loses too much bone, makes too little bone, or both of those things are happening at the same time. And then again, that end result is that the bones are becoming more porous, less dense, and therefore there's that risk for fracture. The most common sites that we see osteoporosis in the body is going to be the spine, the hips, the long bone of the legs, and then the wrists. So those are the areas that we really want to place the most emphasis and focus in our strength training routines. When it comes to concerns with osteoporosis, one of the biggest, most obvious concerns is that risk of fracture. We've already kind of covered that a few times here on our first slide. So those fractures can be related to falls. So with more porous, less dense bones, falls become a lot more risky. Or they can be a result of compression fractures. So that's when a portion of the vertebra fractures because of the pressure of the or because of that loss of bone density, causing that bone to be more soft, porous, and therefore susceptible to that fracture. The other concerns with osteoporosis that are more on the emotional side is anxiety, isolation. So, having this fear of falls and fracture can cause people to really pull back from activities that they loved. And maybe that results in a lack of movement or a lack of confidence around moving around. And then people become, more sedentary, and that has a host of metabolic and other concerns as well. So, just so we have again this common language to talk about what's going on in the bones, in normal bone remodeling, we have a few cells that we want to pay attention to, namely the first two. Those are the ones we're going to talk about the most today. So, osteoblasts build up new bone, so they're responsible for bone formation. And osteoclasts break down old bone tissue, and so they are responsible for bone resorption. Osteocytes are mechanosensors in the bones that detect strain and they influence the activity of osteoblasts and osteoclasts. With osteoporosis, the big picture idea that I want you to understand is that osteoclast bone breakdown is outpacing osteoblast bone building activity. So that end result again is that loss of bone mass. When it comes to strength training and exercise for osteoporosis, we look to Wolff's Law, and this is kind of the foundation of our bone strengthening theory or guidance. And that Wolff Law states that bones adapt to the mechanical loads that are placed on them to become stronger. And I think it's really important to take a moment here and realize that that law also excuse me, that law also applies to the opposite effect. So if you are not loading the bones have no reason to lay down more tissue and therefore they become weaker and less dense. So there's two inputs you can give them, more load or less load, and it's going to have a result on either end of that. When it comes to what type of loading is the most effective for building bone, it's actually compressive loading. And I know that gets a little bit confusing because we talk about compression fractures, but that loading that is going to become from the top down, we're going to talk about this a lot in a moment, is actually very healthy for the bones when it's done in a correct posture. So compression fractures often happen to the front of the vertebral body, so closer to your front side of your body. And that is often as a result of the pressure of poor posture kind of pushing down and having an effect on those bones. When we load the bones with good posture, we create a nice healthy compressive force that stimulates those osteoblasts to lay down new bone. So we can get that compressive force through a few different forms of exercise. And the first one is going to be axial loading. impact exercises, and then it's really important that we practice progressive overload. And don't worry, we're going to go into detail on all three of those things very soon. Sufficient loading is really important. We need to make sure that we're providing enough stimulus to tell the bones that they need to get stronger. Okay, so first thing here, we have our axial loading. So remember, that's a healthy form of loading for the bones. And what that means is a top-down loading. So you can think about this as if we're loading in the same direction of gravity, so coming from the top of the body and creating that healthy compression down. You can kind of think about the bones getting this little bit of a push together, and that is what tells them that they need to lay down more bone tissue. Some exercise examples of axial loading are going to be your overhead press, your deadlift, your squat, and even your farmer's carry. And I know that that one can be a little bit of a mind game because you're thinking axial loading, overhead press, that makes sense. The weight is above you, it's creating that healthy compression down. But when we take the weight down next to our sides, you might question how that's axial loading, but you can imagine if you're holding two heavy weights down by your side, there's this pull of the weight pressing your shoulder girdle down, creating that healthy compression that translates through the spine and even down into the hips. We'll talk about that in our exercise demo as well. I'll give a nice little demo of all of these movements. So if you're not familiar with these exercises, don't worry. Next up, we have impact exercises. Impact exercises also create a healthy compressive force on the body, but instead of coming from the top down, we're actually hitting the ground and creating a ground reaction force that travels up through the body. This creates that mechanical strain on the bones, that Wolff's Law, that triggers the remodeling and strengthening of the bones. These impact exercises are measured as a multiple of body mass or your body weight. So it's how many times your body weight is that exercise, how much force is that exercise putting into your body? So you can see here that walking is just barely above your own body weight, which is why walking doesn't equate to a lot of bone strengthening effects. Whereas if we come up to something like a heel drop, we're getting about 3 times the body weight. I think it's also important to note that these numbers are not set in stone. So something like a heel drop you can do with more or less force. And we teach that in our program to make sure that we're not going too much too fast with impact training. So we can always play with these exercises to increase or decrease the force that they're creating, depending on how we instruct and perform them. But we want to make sure that we're getting enough impact that there's a signal to the bones that something needs to happen to get stronger in case that happens again. So your body's really efficient. It doesn't want to use extra resources unless it has to, and laying down new bone is an expensive process for the body. So if you're not telling it, if you're not giving it the signals that it needs to know that you need more bone, it's going to be really conservative. It's going to use that energy for other things. So we have to be kind of particular and intentional about how much load and impact we apply onto the body to let it know that this is something we actually want to happen, this bone building effect. And then in order to make sure that we are able to sustain bone building through the long haul, we need to practice something called progressive overload. Progressive overload is a really key principle in any smart strength training um, program, excuse me, but it's really important when we're thinking about bone density as well to make sure that we don't plateau. So progressive overload is the idea that we need to gradually increase the weights, the resistance, or the challenge of an exercise to continually challenge the muscles and the bones to get stronger. If we kind of coast on the same amount of weight or resistance or the same exercises, then your body's going to adapt to that and there's going to be no more reason for it to get stronger, both in the muscles or the bones. When we implement progressive overload, we just want to use this idea of rate of perceived exertion. So that's that RPE on the screen. And that's how hard does the exercise feel? So if you have been doing, let's say, your overhead press with 5 pounds at 10 reps for a while, and at first it was really hard, but now it's starting to feel easy. That's a good sign that your body has adapted to that challenge, and now you need to give it a little bit more to continue to influence the bone and the muscle in the direction you want them, which is to be stronger and denser. So to do that, we can play with a few different variables. We could increase the weight, we could increase the reps, we could do another set of the exercise, or we could challenge the form or the position of the exercise to make it harder. So a smart trainer will be able to work with you to determine which direction we want to take in order to continue that progressive overload. Now, strength training is the kind of bread and butter of building bone density. So that is kind of our big key piece of the program of a safe and effective exercise intervention for osteoporosis. But there's more to bone health than just density. We also want to improve your posture and your balance, and that is going to support that risk of fall prevention or fracture prevention. So a holistic program is going to, again, account for that fracture prevention, and we're going to do that through supporting balance and posture. Balance is really important because we don't want to fall if we can help it. So if your bones are a little bit more weak, more porous, we want to make sure that your balance is really good so that if you fall or if you find yourself tripping, you can catch yourself, you have better reaction and response to that fall, or the risk of falling is lower in general. Strength training is a really important part of balance training, but you can also really target that very specifically with balance exercises as well. So we like to use both. And then when it comes to posture, posture is a really important part of fracture prevention as well, because as I've mentioned, that compression fracture. So again, that front of the vertebra is more susceptible to fractures. So when we have this kind of poor posture where the body is rounding forward and it's placing more load to the front of the vertebra, we increase the risk of compression fractures. When we look at posture, we want to bring the spine more upright. We want to create a nice long plumb line with the head stacking over the shoulders, shoulders over hips, and hips over your feet. And we want to make sure that we're practicing that good posture in our strength training, once again, so that compressive load is going in a nice, healthy direction all the way around the vertebra instead of more towards the front. We utilize, again, strength training for posture support because it's not only about opening up the front of the chest, but making sure that the shoulder blades can stay stable on the back of the body, that the muscles along the back of the body are nice and strong and have endurance to hold you upright for longer periods of time. So we utilize strength training in exercises like band pull-aparts and three-point rows to help support that posture. We also utilize yoga to help us mobilize the spine, the shoulders, the neck to improve our breathing, our rib cage movement, all of which relate to posture. We also use yoga in a more restorative and recovery based way. And we know that stress can really impact the way that we're walking through the world. So, having this really supportive recovery and restorative practice can help you to feel more at ease, more open, and that also relates to your posture. So, we take a holistic approach to just about every aspect of our program here, relating it to strength training, to yoga, and just making sure that we're really addressing each of these pieces in as thorough of a way as possible. Now, when it comes to safe and effective loading, I know that there is a lot of fear around loading, and that is really understandable. You hear this idea that your bones are weak, they're fragile, you need to be really careful. But we also need to remember that principle, that Wolff's Law that tells us that if we're not putting any stimulus into the bones, that pattern's just going to continue to get worse. So the idea here is that we actually need to just take a really smart, slow, and progressive approach to strength training. So it's not that adding load to the bones is going to hurt you, but it's actually going to help you. And it's actually a necessary part of improving your bone health. It's also a necessary part of improving your longevity, your mobility, your strength for the long haul. Building strength is also just a really incredibly powerful confidence booster. When you start to feel more strong and capable in your body, it allows you to go back to some of the exercises or the activities that you loved, and you can kind of rebuild that social and community part of your life again. And we just really want to kind of build that confidence nice and slowly. So we don't start by loading you up with really heavy weights. We meet you where you're at. So that might be body weight, might be resistance bands, or really light weights. We focus on the form, and then we use that progressive overload to just slowly increase that challenge over time as your body adapts and when it's appropriate. We also want to focus on efficacy. So we're not just strength training willy-nilly and throwing any old exercise at you. We're thinking about exercises that are going to specifically create the impact that we're looking for. So we're looking at axial loading to target the spine. So we're going to place those weights above the spine or place them where the pole of the weight is going to create that healthy compression. We're also thinking about the wrist. So we include weight bearing exercises like tabletops and planks to focus on those bones of the wrist as well. And then those impact exercises, again, are really impactful for the hips because that force is coming up and it's going to meet the bones of the hips first. So we're really thinking any exercise that goes into our program, we're thinking, what is this loading? What's the intention? And is it effective for our goal, which is to improve those sites of osteoporosis? And then once again, we just build that comfort and confidence with the movements nice and slowly, and we're here to support you that whole time. When it comes to strength training, it's easy to kind of fall into these kind of like pitfalls or have these challenges that you might face as you're navigating learning something new. So, things that we want to just be mindful of is improper form. In our program, we have a coach who's there to look at your form to give you support. Inadequate loading. So we want to make sure that you're challenging yourself enough, but not too much. So we want to hit that sweet spot in the middle. And again, a coach can really help you to navigate that sometimes tricky waters. We don't want to neglect other forms of exercise. Cardio and other things are also very important, but we also need to make sure that we're focusing on the thing that's going to make the biggest difference for your goal. So it's again kind of finding the balance between those two. Finding time and confidence, again, a good coach can really help you to navigate those common challenges. But I think it's also really important to remember that you are worth investing time into, and you're also worth not canceling on. It's so common for people to kind of shove their exercise routine to the end of their day or to the back burner, but you're worth not canceling on. You're worth keeping yourself in the calendar. And that's something that, again, we can help you kind of navigate and support you with. It's also really important that you work with a trainer who is experienced with osteoporosis, someone who knows the contraindicated movements, someone who's able to think effectively about what movements are going to create the impact that we're looking for. We also think that creating a community is a really key piece of this because that feeling of isolation can play a huge role in making this diagnosis much more challenging. And having a community of people who understand that challenge can just make you feel supported. It can give you that little boost you need to know that you're not alone. And then, of course, seeking professional guidance, a strength coach who understands osteoporosis, a doctor who's able to support you. Make sure that you build your team. There we go. And then we have our demo here. So if you want to join for the demo, you're welcome to. But if you want to just watch and learn a little bit about the movements that we think are some of the most effective for improving bone mineral density, then you can just watch and maybe come back to this and move through the demo on your own. But these are the equipment that I'll be using to go through a few key things here. So I'll leave this up for a moment so that if you want to grab anything, you can.
Thanks so much, Michaela. And while that slide is up and you're getting set up for the movement demo, I'm going to go ahead and share a poll with all of you in the audience today. We're really interested in knowing what your experience has been like as far as getting guidance on how to effectively and safely exercise for bone density. So I'm going to launch the poll here, and it's just one question, takes probably about 15 seconds to answer. Um, and we would love to hear your experience so far because having this information also helps us to develop better programs to meet you better where you're at, make sure that our service is completely aligned with your specific needs. And I see a bunch of you already filling it out, completing the poll. Thank you so much. Um, uh, Unfortunately, results quite disheartening as in our previous webinars as well, that the guidance has been at best vague. Um, I'll leave that
Yeah.
open for another few moments here. And then, Michaela, maybe you can also talk us through what's on this slide, which we can reshare at the end of the webinar as well.
Sure. So this slide just tells you our upcoming program dates. So we have programs starting each month for the rest of the year. And all of these programs that span the holidays have extended access. So we give you a little bit of time around the holidays so that your routine can stay consistent, but it's not quite so overwhelming. And then we have a QR code here. If you want to use your phone, you can scan that and it'll bring you right to our website, and you can use that to get more details on our program. And I lost myself. I lost the video. So I might stop screen sharing in a moment.
Yeah. Yeah, you can pop out
I'll give you
whenever
guys
you're
just a
ready.
second to scan anything you need there. All right, and it looks like everybody has answered the poll maybe. So I'll stop screen sharing and I'll move into the demo portion here.
And just as a reminder, feel free to keep popping your questions into the chat there, into the Q&A, excuse me. And yeah, we'll have lots of time to answer all these after Michaela completes the movement demo.
All righty. So as we come into our movement demo here, I'm going to talk through a few different things. I'm going to talk through some loading exercises, some impact exercises, a couple of balance exercises, and a couple of posture exercises. I'm going to take my socks off here so you can see things a little bit better. It's getting cold in upstate New York, so socks are usually a must. The first exercise that we have is going to be an overhead press. For this, I'm catching onto a pair of lighter weight dumbbells, and I'm going to stay standing here. When we think about the overhead press, this is one of the most kind of like obvious and clearly understandable examples of your axial load. So with these two dumbbells, I'm going to bring them up to my shoulders into what we call the rack position here. And then thinking about taking those arms and just pressing them straight overhead. And here I'm doing my best to try to get the arms next to the ears and then have that weight pressing right over the body. I'm gonna just take one arm down here so that I can use it to point. But you can imagine here that with a nice straight long spine, you can see that direction of force coming down through the wrist, through the spine, and into the hips to create that nice, healthy compressive force through the body. And so with that overhead press, we like to push up, pause for a second so you can get that nice healthy loading, and then bring it back down. I'm going to turn to the side here because I also want you to notice my posture. When I press those weights overhead, I'm doing my best to control my posture here to have a nice neutral spine. The tendency is actually going to be to fall into extension, the ribs press forward and you arch the back. So we get a little bit of core support here to help keep that nice and long spine. You can do a few repetitions of these and feel that weight kind of pressing down from overhead. So that's one of our favorite and most utilized exercises for axial load. But we can also use exercises like our squat, our farmer's carry for axial loading as well. With a goblet squat, we're going to hold that weight across the top of the bell there and kind of cup the hands on that, and then bring that nice and close to the chest. The feet are going to come a little bit wider than your hip distance, and you can turn those toes out slightly if that feels good in your hips. And then we're thinking about sending those hips back and down, and then pushing through the feet to stand up. I'm going to turn once again to the side because this is a better viewed from the side type of exercise. Hips go back and down. I'm keeping my spine nice and long here. And even though this weight is kind of in front of me, it's creating again that force across the shoulder girdle that creates that healthy compression down into the hips and the spine. This is a great way when we move through the lower body, it creates more stimulation of those hips, of the bones in the hips. So a goblet squat is a really great way to support that bone density. We can also play with the squat and do something like a rack squat. So those weights are again above the shoulders, which helps not only the wrist, but the spine and the hips. And then we move through that squat pattern again. Now we can take those weights down by the side, and this is where we have to think a little bit kind of creatively about how that force is moving through the body. If you have the weights down by your side, or if you can think about when you've carried your grocery bag, you can feel that force of the weights pulling down. And once again, we're creating that pull across the shoulder girdle, which sits on top of the spine and creates that healthy force down. With a farmer's carry, we just walk nice and controlled. And this is a really functional exercise. So, again, if you need to carry your groceries or other heavy items, this is something that really easily translates into your day. We can hold them in the farmer's carry and then bring more isolation to each hip joint in turn by doing something like a lunge where we step one foot back, we lower down, and then we come back up. So this would be a split squat where we stay kind of in that same position and come up and down. Or we can add a little bit of an element of balance as we step one foot back, come down, step forward, and switch. So now we've got a little bit more of a dynamic exercise that's also working your balance. All of these exercises primarily are focusing on the hips and the spine. But like I said, we also love to utilize exercises like plank and tabletop so that we can get that axial load moving through the wrists. I'll show you quickly a plank here, and you don't have to do this one if you don't want to come up and down from the floor. But you're going to come down to the floor, or I will come down to the floor and bring my hands underneath my shoulders. Now you can always do kind of this supported plank where the knees stay on the ground. And once again, you can imagine that force of gravity moving down into the wrists. If this is pretty comfortable for you, you can come up into that full plank by lifting the knees. There are lots of variations you can do in a plank. So we play with a lot of those different variations. We can tap a shoulder, we can move a weight side to side. All of that comes with time. So those are exercises that we really like to prioritize and focus on for that axial loading. And then we also like to pull in exercises once again for impact. One of our favorite exercises for impact that is really easy to progress or regress as needed for the person is a heel drop. For a heel drop, you're just going to stand nice and tall, lift onto the balls of your feet, and then let those heels drop down. And we're intentionally landing with a little bit of force there so that we again get that vibration up through the body to target the hips and the spine. Heel drops you can do with shoes on for a little bit less impact, or you can eventually progress to doing them without shoes for more impact. You can also keep the heels pretty low and just do a little drop for less impact. Or as you're comfortable, you can get nice and tall on the balls of the foot and then let those heels drop further down for more impact. We do always recommend that you do them on some sort of surface with padding. So that could be a yoga mat or a carpet, but not directly on the hardwood. Or if you have like a concrete garage gym floor, don't do them directly on concrete. We also like to use stomping. Stomping is a really easy and accessible way to get in some impact. So it's literally just stomping. For many people, the idea of doing big jumps is intimidating, whether that's for their joints or their just fear of the movements like that. So stomping is something that we can do pretty much anywhere, anytime. And again, it's very scalable. You can do a little stomp or you can do a big stomp. So there's lots of variation to play with. And then something we also like to do is to try to get that impact from multiple directions. So one of our favorite exercises for that is a 3-directional lunge. You'll need a little bit of space around you, and you're going to step 1 foot forward. You get some impact as you come down, you come into your lunge, and then you push off. And then you step out to the side, impact through that kind of lateral movement, and then come back, and then step back and forward. You can do this with or without weights. And this is a great way to just start to get more angles around that hip because that's a kind of funny shaped bone. So we really want to get that force of direction moving in as many different ways as possible. Next, we're going to move into balance here. So for our balance section, you'll just want to have a block and a ball. Our first exercise is everybody's least favorite exercise, and this is called march with rotation. Over time, you might learn to love it, but it's a challenging one, so be patient with yourself. You can use a block, a pillow, a foam roller, just something that's kind of light that you can hold between your hands here. And you're gonna take that out in front of you. Your elbows can stay soft. We'll start with just a tiptoe here. We're gonna tiptoe 1 foot in front of the other, and then turn towards that front leg, bringing your gaze with you, and then come back to center, step down, and come forward. Rotate and come back. When we rotate, we're stimulating the inner ear and the eyes, as well as our kind of body awareness, which are the 3 systems that make up balance. So we're really getting all the components of balance with this exercise. If that feels pretty easy, you can start to float your foot a little bit higher and then rotate. Come back up, step, float, and rotate. So go ahead and give that one a shot there and see how it goes if you're following along. And then next we're just going to come in to something called a ball toss. And for this, all you'll need is a ball. And if you don't have a ball again, it's okay. You can just kind of watch and play with this later. The ball toss, once again, is a really dynamic version of our balance exercise because it's utilizing all of the systems of balance together. It's also a good way to kind of build that coordination that translates into daily life a little bit better. With a ball toss, you can just toss that ball side to side and catch it with the other hand. Here again, your eyes are following that ball, your head is following that ball, and we start with 2 feet on the floor. If that's feeling really easy, you can start to come onto a kickstand. If you're concerned about your balance at all, do this next to a wall or a chair, something you can put your hand onto if you need to. And then again, you just kind of follow that ball as you toss side to side. And then you guessed it, if that's feeling pretty easy, you can remove a foot. And you can tell that immediately changed the game for me. So that's a really fun exercise, and you can even make this a partner exercise. If you have someone at home, you can throw a ball back and forth and try standing on one leg. That can be really fun. And then lastly, I do want to just get into our posture. So once again, I talked about building that openness through the chest through yoga, and then building that strength through the back body through our strength training practices. One of my favorite exercises that actually does a little bit of both at the same time is going to be a band pull apart. And I actually want this lighter band, sorry. With a band pull apart, we're going to take that band out in front of us and hold that band with our hands. Draw the shoulders down just away from the ears so the neck is soft. And then you're thinking about pulling the hands apart from each other and feeling the shoulder blades squeeze together. And you can see how this kind of opens the front of my body And then as I come back to center, I'm going to take it at an angle, opening across the front as my shoulder blades squeeze together, and then I switch. This just gets different muscle fibers engaged to make sure that we're strengthening cohesively across the back. And if you're doing this with me, depending on the weight of your band, you'll probably start to feel that heat build up in the upper back, and that's a good thing. Those are those muscles getting stronger. So this is one of our favorite exercises to start to build some openness across the chest, some strength in the back. We also love to utilize something called a 3-point row. For this exercise, you'll want a chair and just one dumbbell. We're gonna hold onto that dumbbell in one hand, and then we're gonna send those hips back with a nice long spine and place the other hand down onto the chair. Push your hand into the chair, and then we're rowing that elbow up and back and coming back down. Again, you can see how as that elbow pulls back, I get that nice openness across my chest. And again, if you're doing this with me, you'll probably feel some strength start to build around the shoulder blade there. There we go. And then coming back up. Once again, we utilize a lot of different exercise for our strength, for our balance support, especially in our yoga practices. So these are just a little taste. And then the very last thing I want to talk about here is just the safe position of your spine. So you'll notice with all of these exercises, my spine stayed in a nice long neutral position. And even when I was picking up and putting down my weights, I tried to maintain that. We call that a hinge position. And for that, I'm just going to use a dowel. You don't need a dowel here. So this is just more for a visual. But a hinge is where we keep the spine nice and long, and then the hips move back so you can see I'm staying connected to that dowel. I have a nice long spine as my hips move back. My chest comes down. And even though my chest is coming down towards the floor, I'm not rounding the spine, which is what we would want to avoid for that risk of compression fractures. Instead, I'm keeping that that spine nice and long, lowering the chest down to the floor as the hips move back, and then coming back up to stand. This is going to be a really key thing for moving through your day more safely, as well as moving through your strength training routine more safely. And we even talked about that squat already, but that keeps the spine nice and long as we bend down to pick up heavy objects in your day. So all of these strength training exercises actually translate really beautifully into a safer movement pattern for your days as well. Okay, so that's it for the movement demo, and I'm sure we have lots of questions.
Perfect. Thanks so much, Michaela. Give me 1 second here to get us set up. Thanks to everybody that's popped questions into the Q&A. We'll start going through these right now. Whatever questions you have brewing in your brain, feel free to drop them in there and we will answer as many as we can. So Joan has a great question about progressive overload, this notion that we need to continue to increase and vary the challenge in order to maintain ongoing bone density adaptation. So she says, I hear you about continuing to challenge or you plateau, but what exactly happens if you plateau? Do you lose anything or just maintain if you stay with the same exercises and weights? I'm guessing that's going to depend on quite a few variables that are unique to you, Michaela.
Yeah, I would say that one's a hard one to answer with like any kind of black and white answer, which unfortunately is often the case. But I would say you'll likely maintain, and at the worst, you could start to lose some bone. And a lot of that is going to depend on stress, diet, lifestyle, medications. So there's so many things that we can't account for. But we do want to avoid plateauing as much as possible because if you have osteoporosis, the goal is to gain bone density.
Yeah, so I guess it just depends again on that the ratio between the bone laying down and the bone being resorbed happening in the body. And lots of factors influence that, like just like Michaela said. This is a great question too. Does a seated leg press provide axial loading for the hips? It's definitely going to have some impact there, some stimulus. Um, but you are then missing out on other movements that you could be doing that would not only load your hips, but your spine and your wrists as part of that same movement. Something like a goblet or a front rack squat. Michaela, maybe you can also talk a little bit about why we favor free weights rather than machines like the seated leg press.
Yeah, and I should have touched on that on the balance piece. But that balance is going to be really improved with using free weights. So free weights meaning dumbbells, kettlebells, even resistance bands, they kind of take your body a little bit out of its center of gravity because you're moving a weight around, and that causes your body to have to navigate that weight and then kind of reorganize and control that movement. So we really like the use of free weights because you get a little more bang for your buck in a sense, because you get to improve that balance as well as your strength. Um, and then that seated leg press, it really doesn't translate into a lot of functional movements. So we're really about like, how does this translate into your life? Um, every time I fill up my dog food, I think about like squatting and how it's so helpful because I have to pick up that 50-pound bag of dog food and pour it into a container. So the leg press, while it would definitely strengthen the legs and the bones of the hips, it's not necessarily going to translate into a movement pattern like that.
Yeah, great answer. And just to kind of piggyback off of that a little bit, everything that we do here at Kari, our guiding principles are safety, which is obviously incredibly important, but also efficacy. So, where there is a better or more efficient alternative, we will always go for that one. That will always be our recommendation. And that applies across the board with free weights versus these gym machines, which, aside from the dynamic balance component, which is missing with the machines, it doesn't translate over into daily life as much, like Michaela said, because if you think about it, the machine is taking you through a preset trajectory of movement that you're not having to control. So you're just not getting as much out of it as you could be. Um, Paula has a question about what the ages of the women on this call are. So we can't see people's ages, unfortunately, but I can tell you that in our programs, we have people ranging from their early 50s all the way into their late 70s. People, with varying degrees of bone loss, different DEXA scores, ranging from just like mild osteopenia in one hip to very low DEXA scores across the board. So like our program comes with individualized one-on-one guidance for everybody. So we are able to cater to all of those differences depending on where you're at in your journey. Great question here about jumping rope. Is that good for impact? And if so, how often is recommended?
Yes. So that jump rope, it is good for impact. It is an impact exercise. I think I need to change the image on my slide. I was actually looking this morning for a better one, and that's just the only impact exercise that I can find a little cute person for. Um, but I don't typically use too much jump roping for the people I work with. It really depends on your bone mineral density and some other factors. We really like to use things like the stomps, the calf raise and heel drops, just because it's a little bit more controlled. But if you are maybe kind of doing this preventatively, a jumping rope could be a good option for you if you are not strictly concerned about your bone density right now, but trying to work on that for the future. And then as terms of like a recommendation for how often, again, too many variables for me to give any kind of big picture answer here. I'd have to be talking to the person in front of me.
I think one of the things that we often discuss when it comes to impact training specifically is that it is very effective for targeting the bones of the hips. But the other thing that the bones of the hips really like, as Michaela sort of alluded to, is that the hip joint can be positioned into a huge variety of different positions, and it really likes to be stimulated in all of those different positions. So the jumping is going to create an impact and it's going to have an effect, but you also want to vary the positions in which the impact is happening. So the position of the femur relative to the pelvis. So incorporating that variability is also going to give you more bang for your buck. I love this next one. We have so many thoughts on the vibration plates, Michaela.
Yeah, we're not the biggest fan of vibration plates. For one thing, the vibration is very low. So the idea, again, is similar to the idea of impact, where that force is coming up from the bottom. But with an impact exercise, you get a lot more of that impact of that vibration through the body versus that low level vibration plate. It's also going to dissipate as it comes up through the body. So it's already at a low level, and then it's going to dissipate as it makes its way up through the bones and the other tissues of the body. So by the time it hits the target tissues, which would be the hips and the spine, it's not going to have a huge effect. And then again, we're missing out on the functional benefits of strength training.
We actually looked into this in quite a bit more detail just very recently because we got a specific question about the Meridyne plates. And just to give you kind of to loop back around to this notion that everything that we do is evidence based and research backed, if you Google research osteoporosis strength training, you're going to see that there's almost 300,000 studies that have been done on that. If you do the same for vibration plates, you'll come up with maybe a dozen with very inconclusive results. And one of the things that really stood out to us when we did the research on this was that where they did see bone density improvement, one study where they did see bone density improvement as a result of the vibration plate use, the improvement happened in the distal tibia, which is the bottom of your shin bone. So that is not a common site of bone density loss or the riskiest ones that we really want to address. And the other thing that that illustrates, like Michaela was saying, is that the force disperses so much as it makes its way through the tissues of your body that the only place where it's really meaningfully having an impact is closer to the source of the vibration plate in your ankle. So for that reason, we simply don't recommend them just because there isn't a ton of high quality research at all. And the research that we do have has very, very mixed results. Hopefully that answers your question. Um, Paula is asking about in person classes. So, our program is digital so that people have access anywhere and everywhere because one of the issues that we identified was a huge lack of access in suitably qualified professionals like Michaela. But she does do an in person program. Maybe you can just briefly touch on that, Michaela.
Yeah, myself and Sarah, the other co-creator of the program, we host an in-person program that is in upstate New York. We're in Saratoga Springs. So if you're in that area and you want in-person classes, we're here. But we also have this virtual program which can reach so many people as well. And we've seen pretty much the same results of doing the in-person or the virtual, which is improvements in bone density, improvements in functional movement and confidence. So don't be afraid of the virtual program either.
It's very, very interactive. You are basically in one-on-one private communication with your coach every day. There's the Zoom meetings where you can also get a form check and get somebody to look at you moving, and receive other guidance and have your questions answered. The platform through which we deliver the program also has a really convenient built-in video integration, so you can super easily film yourself doing a movement and have your coach answer your question that way as well. Elaine is asking about the tendons in her left hand and wrist, which are short and tight and painful when weight bearing. Other hand, no problem. There are tons of modifications that you can do to accommodate something like that, including not having your palm flat on the ground, but maybe making a fist. We sometimes also use wedges for under the wrist for things like that. Michaela, what else do you have to add to that?
Yeah, so there's a few ways we can kind of support the position of your hand, and I don't know, enough about your situation, but if it's a result of something like a surgery where you have plates and screws, you'll probably always have limitations in that range of motion. But if it's just something that has kind of occurred from whatever movement pattern your left hand is going through, it's possible that with some mobilizing and strengthening of the wrist that might get better and you might be able to weight bear more easily. And we actually have some wrist strengthening and mobilizing resources as part of the program because we know that wrist weight bearing on your hands can be a challenge. There's also a block that we like, and it's a yoga block, but it almost has like a handprint in it. So that way you can have, I can't do it in this position, but that way you can have your hand in a more neutral position instead of that really extended position, but still get the axial load through it in tabletop.
So we do have lots of people coming into our programs with various limitations and prior injuries. And this ties into the next question from Irene about having knee issues. So tabletop squats and lunges are not good for me. I feel that it would limit a lot of the exercises I can do with your program. Irene, I have some really great news for you. There are so many ways to modify all of these movements so you're still getting the axial loading. And from a general sense, you can do things like modifying your form and your range of motion, so not doing the movement as deeply. We also have a ton of specifically created content for modifications with these exact exercises so that when people do have knee issues, they can still do the exercise in a slightly different way that gives them the axial loading. Michaela, maybe you can talk through a couple of like common modifications that we might do in our program for somebody with painful knees.
Yeah, so a lot of what we do is talk about range of motion. So first thing first, we would ask you to send a video so we could look at your form. And then oftentimes from that, we can give you some cues, some tips to make sure that you're kind of using the right muscles and not overloading the knees so that you'll try to target more of like the glutes and the back of the body. So we would definitely look at your form. And then in terms of kind of modifications, we would probably reduce your range of motion. One of my favorite modifications for lunges is doing a lunge with your knee to a block. So that kind of creates not only a decrease in the range of motion, but it actually tends to really improve the form of the lunge because it's giving you a really clear target of the direction of the movement. So you're not kind of shifting forward or back and loading those knees in a little bit of a funky way. And then we also use a lot of step ups and other exercises. So we can definitely play with subbing in a step up for a lunge. A lot of it just comes down to the individual in terms of how we modify. But I would say that knees is probably the number one complaint that we get, and our coaches are really, really good at supporting people with knee pain because, again, it's just this really common kind of pain point for people, and, I think it was in the June cohort this year, we actually had a client who came in and she was having a lot of knee pain, and within the first 6 weeks of the program, it had almost completely disappeared because she was building more strength and support around the knee, and she was moving in a better pattern. So a lot of times we see that people come in with pain points and they leave with less. So oftentimes building some strength around those joints is really supportive as well.
Great answer. Thank you. Um, this is an excellent question. Can we break up the exercise routine into 3 to 6 times a day? Breaking up the workout into different chunks, if that's what your schedule allows for, is one of the things that we recommend to people that have busy schedules. So, Michaela, maybe you can talk a bit about that.
Yeah, I actually, I think people have an idea that has to be like really all or nothing, and it doesn't. Consistency is the biggest predictor of success. So if consistency from you means that you do little movement snacks instead of one big workout, I think that's really great. And then I also like that too, because sometimes we do one big workout and then we sit at a desk for like 8 to 10 hours. And that is good. It's good that you got your workout in, but then sitting for so long can be like a little bit of a counterproductive thing to do. So when you kind of have those movement snacks, it means that you're getting more movement throughout the day, which is important in some other, like it's good for metabolic health, for blood sugar to be moving more throughout the day. So if it's how you get your workout in, I'm all for it.
Carolyn is asking about the effectiveness of walking with a weighted vest or belt. We would not recommend a belt because remember, we want to be compressing, axially loading the bones, including the spine. So when the load is below the level of the target tissue, it's not going to be effective. So a belt we would not recommend for that reason. And we do talk about weighted vests quite a bit. Michaela, maybe you can expand a bit more on that.
Yep. So the vest we do wear and we do utilize, but we also like to remember that the strength training is the bread and butter of the program. And then these other kind of tools and tricks are the cherry on top. So with a weight vest, what the research shows from what we can tell is that impact exercises and resistance training with the vest seem to be more effective than walking with it. So that's how we personally utilize it. We have a weight vest circuit in the beginning of our program that includes some balance exercises, some impact exercises, and then we move into more of like the strength building section. We take that vest off and we move into the strength building section. But we love a weighted vest to provide that nice, healthy, compressive force through the spine. And it's weighted all the way around the body. So again, we're getting that even loading around the body of the vertebra.
Perfect answer. Thanks. Interesting question from Donna. Does a vibrating balance board help with bone osteoblast? Hopefully, we kind of covered that in the question about the vibration plates. Same thing, it's a very low force to begin with that is then dispersing and becoming even weaker as it makes its way up through the tissues of your body. With the balance board, obviously that's intended to improve your balance, but again, our recommendation is for free weights resistance training because you're getting all of the functional mobility and strength benefits, which actually translate much better into you having better balance in daily life as well as building that strength. Um, Oh, another great question. How often do the strength videos change in your program? So we want them to change often enough that it stays interesting and fun for you and that there's enough variability. We don't want them to change a ton because we do want to get consistency with these evidence-based exercises that we know to be really highly effective for not just bone density, but all the other functional mobility and strength benefits. Michaela, let's expand on that a little bit.
Yeah. So for we have our original 13-week program, so that's kind of like your foundation building program. And then once you complete that, you can move into the maintenance program. In the 13-week program, the exercises stay more or less the same throughout the 12 weeks of training. There's an introduction week at the beginning. So they stay more or less the same, but they're broken down into 3 phases. So in phase 1, we're focused more on building that form, improving mobility and stability. So the exercises are a little bit lighter weight, body weight, and they're really focusing on kind of getting you used to the program, used to the exercises. And then when we move into phase 2, we start to add in more load. And with that, some of the exercises have a slight change in instruction. So, for example, step ups in the beginning, we do body weight. In the second phase, we do with load. So there's a little change in that instruction on how to hold the weights and do the exercise with load. And then when we move into phase 3, we're focusing on controlling the movements. So if you're at all familiar with exercise talk, we focus on eccentric training, which is slowing down the lowering phase. So once again, you'll see the same exercises, but now we've played with some of them and we're starting to play with that tempo of the exercise. So the instructions will vary a little bit. When we move into the maintenance program, we do start to introduce a little bit more variety so that we can get that good progressive overload and start to challenge the exercises a little bit more. And so when you move into the maintenance program, you get about 4 new videos per month, and then that continues each month as you go through. You'll see new exercises cycling through.
Perfect. Thanks so much.
Mhm.
Carolyn is asking about whether it's safe to do forward folds in yoga.
Yeah, so forward folds in yoga, that one can be a little bit of a tricky one, but we're gonna come back to that idea of the hinge that I showed with the dowel. So instead of rounding forward and really flexing the spine, we're actually just gonna send the hips back, keep the spine nice and long, and I like to come down to yoga blocks or some sort of elevated surface, so that way we don't have to kind of force any deep range of motion and we can keep that nice, long, straight spine. We do utilize cat cow in our yoga practice, which has a little bit of flexion in the spine, but we're taking that from kind of an axial loaded position into tabletop, so we don't have as much of that axial force through the bones anymore. And then we're cueing that in such a way where it's more about a gentle movement and providing circulation for the muscles and the discs of the spine rather than really forcing a really angry cat shape. So it's all about kind of intention with that one. And we do think that it's important to continue to move the spine. And that is actually the recommendation by Bone Health and Osteoporosis Foundation as well, that we do want to move the spine through various ranges, but we want to avoid anything that is repetitive, fast, loaded, and range of motion. So those are the things that we really want to keep in mind when it comes to a safe spine with osteoporosis.
That's a perfect answer. And maintaining good muscular balance, meaning you're using all of the muscles around your spine, is really important for long term mobility and injury prevention and just avoiding like painful tension from things getting tight and stiff as well. Another thing that actually directly relates to fracture risk as well are the discs in between the vertebrae of your spine, which do not, they are avascular, meaning they don't get blood flow and they stay hydrated and nourished with movement because the movement squishes the discs in between the vertebrae and that's how they get this like healthy hydration and how they stay like nice and plump and thick. And part of the job of these discs is not only to create space between the vertebrae so that they are less likely to come into contact with each other and fracture, but also they are shock absorbers. So they're helping your spine to stay safe in that way as well. So it is almost never our recommendation to cut out or avoid entire movement categories. There's almost always a way to work into it in a way that feels controlled and safe and moderate, and is also contributing to the long-term health of your body and your spine and that big picture comprehensive fracture risk reduction as well. Great question. If I'm traveling and only have a band, are there other exercises I can do to replace the exercises with weights? So when people in our program join and they have like a little bit of travel scheduled at some point, we do offer some resistance band workouts that they can do while they're on the road. I do want to come back to this notion that the axial loading and the progressive overload are like really the meat and potatoes of what needs to happen to improve bone density. So while it's not about being perfect 100% of the time, it is about being consistent. So you would not want these like big gaps in your training where you weren't getting that necessary stimulus. Michaela, what do you think?
Yeah, I mean, I always like to tell people that, like, especially if we have, like, our consults and someone's, like, trying to find the perfect date to join, but they're traveling, it's you're never gonna find a perfect period where you're not traveling, where you don't have family obligations, something isn't gonna happen, but we just wanna make sure we come back to our weighted training, as much as possible, so we do have those exercises available. Resistance bands are a great way to continue moving your body, um, especially when you're, like, traveling, you don't have access to weights, but again, when you come back, we wanna get you back using those dumbbells and loading adequately.
Any tips for protecting our hands? I've had trigger finger surgeries and I'm careful with weights held.
Yeah, so a lot of those tips that I gave about the, wrist, so, like, the yoga block with the handprint can be really helpful, a wedge just to take some pressure off of some of those joints can be really helpful. There are also some specialized weights. I've seen people with, like, rheumatoid arthritis use them. I don't know the name of them. I bet you could pretty easily Google, like, weights for rheumatoid arthritis. But those can be a good way to kind of hold them. They're a little bit bigger. They don't require quite as much of that grip strength. Um, and then there are also things like grips that you can put around your wrist. So you can still find ways to work around that. And then, oftentimes as we strengthen and mobilize those joints, they do start to feel a little bit better.
Yeah, load is good. Challenging the tissues of your body is a really good thing, and in as a generalized perspective, it does help to reduce symptoms rather than exacerbate them. Although, if you, of course, want to be doing all this under the guidance of a very experienced and qualified professional. Julie, great question. What is a realistic goal for improvement with your program? I have a minus 2.5 in L1 through L4 and osteopenia in the femoral neck. Um, I'm going to drop link to our case studies page on our website and all of you can click on and go see the results that other people in our program have accomplished. Whoops, that made the question go away. But I will say that we have people with far worse scores than that in our program. And the the exact improvements are going to depend on a lot of other variables that we're not able to account for. Michaela, maybe you can expand on that a little bit.
Yeah, so bone remineralization takes time. So the bare minimum to see changes in a DEXA scan is going to be about 6 months, but honestly, that's still pretty early. So I would say at least a year or even 2 years of consistent, effective training is needed. But we've seen improvements again in that shorter time span. So it is possible to see those improvements, but some of that has to do with the sensitivity of the machine, and then again, we have so many variables that we need to take account for. What is your stress level? What's your nutrition? Do you have any other co-conditions? Any medications that could be impacting your bone density? So all of those things are going to come together to create your unique situation. And we don't really have like a clear answer on the exact timeline for improvements with strength training. to account for all of those variables.
Yeah, it's very nuanced and very individual. And if anybody is promising you a certain outcome, that could be a red flag because it's not really possible to do that. Um, yeah, that maybe we leave it on that note. And actually, this leads nicely into a question about how often do you recommend DEXA scans. So, like Michaela said, it's less about like how often we recommend them and more about the calibration and margin of error of the machine. So the reason that your insurance will pay for a DEXA scan at 2-year intervals is because that has been sort of deemed to be a long enough period of time that you can make significant enough improvement that the margin of error of the scanning device is no longer a factor. So some of our clients do go get interim DEXA scans, which we certainly encourage if they want to do that. What is another really good option is to go get a body composition scan. So that's measuring how much muscle you have versus how much fat tissue you have. And this might not seem related, but actually, the health of your, like how much muscle tissue you have, is very closely correlated with the state of your bone health as well. So, if you see an improvement in your body composition, meaning you've built more muscle, that is a really, really good indicator that what you're doing is working and that your bone health is going to be improving in tandem with your muscle strength and your muscle mass as well. So this is something that can be really motivating for people. 2 years is a long time to just like stick with something and kind of like hope for the best. So the body composition scan can be a really good interim alternative as well. Let's see. What types of aerobic exercise is recommended in addition to the strength training? I would say any kind that you personally like.
Yeah, I mean, the enjoyment is a huge part of consistency. So if you love one thing, I would just say stick with that. If that's walking, you can always do like interval walking where you power walk for some part of your walk and then you take a little slower of a walk and you kind of cycle through that for the duration of your walk. If you like to run, if you like to cycle, if you like to swim, whatever makes you really happy and consistent.
With the understanding that you will be then more targeting your cardiovascular system
Mhm.
and less your musculoskeletal system. Or you'll be getting some benefits on that front as well, but it's just not going to give you the most bang for your buck with bone density.
Yeah, in
Uh,
addition to strength training.
yes,
Yes.
exactly. Yeah. And just to kind of expand on that a little bit, a lot of our clients who come to us are already very active and have specific activities and sports that they enjoy. So we never tell them not to do those things, but a lot of them start to view the strength training as something that they temporarily prioritize as a means of improving their bone density, which is partly so that they can then continue in the long run to do those activities that they love. So it's not about switching one for the other, but maybe just shifting priorities temporarily so that you can then make sure that you are long term set up to be able to continue doing all the other things that you love as well. Um, what if you do a carry with bad posture? I assume not enough benefit. I think it's less about benefit, although yes, and more about the risk that you might be incurring during doing that, Caleb.
Yeah, exactly. So again, if you have that kind of like poor posture, you're risking putting more weight on the front of the vertebra. That being said, you kind of have to start where you are. So we would just, really prioritize like mobilization, posture support, um, and then transition into heavier loading. But just because you have bad posture, bad, I don't like using that word, bad posture is like not a reason to not do the exercises. In fact, it's a reason to do them to help you improve that. But we would just want to be mindful about your position, your intention of your posture, even if you can't get a perfectly straight spine. Are you engaging the muscles that you need to bring you closer to that goal? So it's not about perfection, but we do want to make sure that you're getting as much of that length through the spine as possible prior to adding load to it.
Perfect. Thanks. What about rebounders? These very much fall in the same category as the vibration plates. Not enough force, nowhere near enough research to be able to suggest that this is going to be an effective bone density intervention, unfortunately. Um, oh, Christine, great question. Do you find postmenopausal women on HRT, hormone replacement therapy, are more successful in building bone and muscle? I would say that would depend on what your initial hormonal profile was and subsequently how effective the HRT is. Michaela, maybe you can answer in a little bit more detail.
Yeah, honestly, I don't know if we have enough like data differentiating our clients between who's on HRT and who's not to really be able to give you that information. Um, we know that estrogen plays a really important role in bone and muscle health. Um, so in theory, probably. But that being said, we have a lot of clients who are not on HRT and are still seeing benefit. So it's not needed to see the benefit.
Yeah, there's so much gray area, so much individual variability. It's very hard to like black and white, like, yes, do this, or no, don't do that. What about stair climbing?
I think stair climbing is great, and there is some impact in stair climbing, but again, we really do want to prioritize that strength training and the other functional movements as well. But if that was a question in terms of cardio, I'm not sure if that was maybe like a piggyback onto the cardio conversation. Stairs are a great way to get cardio.
And you are strengthening your glutes,
Yeah.
so that's going to be something else, yeah. And obviously, being able to go up and down the stairs is a very functional thing that will be beneficial in life, all around. Lindy, you saying you can't find the cost for the initial program. I'm going to drop the link into to our website as part of your answer. But Michaela, maybe while I do that, you can talk everybody through the cost and structure of the program, the 13-week program, and what people are getting included in that.
Sure. So if you pay upfront for the 13-week program in full, it's $9.95. If you want to pay monthly, it's 3 monthly payments of $350. The 13-week program is 13 weeks because it includes an introduction week. That introduction week is used to make sure that your basic movement patterns that we'll be utilizing through the whole program are solid. We ask you to send a video so we can review your form and give you feedback before you load them. So that intro week goes over, strength training principles, core bracing, squat, hinge pattern, overhead press, lunging, rows, and yoga. And then we move into the program in earnest. And that again is the 12 weeks of programming split into those three phases. All of the programming is delivered through an app called Coach RX. And that app allows for one on one communication with your coach, where you can also send text, like typing messages, as well as videos back and forth. So if you ever need any form checks or just want to make sure you're doing something correctly, you can send a video in and get feedback from your coach. The exercises are pre-recorded videos, so you get to do them at your own time. So that's why you're able to split them up throughout your day if you need to. You can even shuffle the days that you're doing the workouts around a little bit to make it match with your schedule better. Um, and then the workouts themselves include 4 days of strength training per week, 1 day of an active yoga practice. It's not like a really fast vinyasa or anything. It's a nice slow and steady flow practice with lots of cues, and it's very targeted to safety for osteoporosis. So you won't see any kind of contraindicated movements in there. And then we have a 1 day of recovery. That recovery I always call like a menu or a buffet, where we have myofascial release, which is like a self massage practice, a gentle or restorative yoga pose or practice, and then a meditation or a breathing exercise. So you can do all three if you have the time and you like to, or you can choose one or two, whichever fits into your schedule or preferences for that recovery day. And then you get 1 day off a week. And that day off is often, depending on where you are in the program, but it's often when we have our Zoom meetings with your coach and your cohort, where you get to kind of connect with your community, learn about the next step in the program, ask questions, have face to face time with your coach. I think that is everything.
Yeah, I think so too. Thanks for the overview there. And actually, just to piggyback off of the information about the program. Thank you for this really kind comment in the Q&A. I don't know who you are because you're anonymous here, but She wants to say hello to you ladies. I started working with your program in August 2024. Best decision ever. All my numbers have improved. Blood work, muscle, gained 10 pounds in 1 year in muscle, I presume, and lowered body fat. Yes, so improved body composition. My body has reshaped completely. I continue to work out 4 days a week and walk too. Drop the yoga part. Sorry, Michaela. I feel stronger. Thank you. So, this is what consistency will do when you are following an intelligently designed strength training, well rounded strength training program. Really appreciate that perspective. Thank you so much. Um, Paula, after the 13 weeks, oh, Claudia, hi. After the 13-week ends, we have maintenance program options. Michaela, maybe you can talk a little bit about that. I will drop that link in there as well for everybody.
Mhm. So the maintenance program is your option to continue after those 13 weeks. We do drop it down to 3 days a week of strength training, and that's to allow you a little bit more time to get back to those activities that you might love, that you put a little bit on the back burner while you're investing in that foundation of the 13-week program. If you don't have an activity that you're trying to get back to, we do include kind of an optional or a bonus weight vest impact circuit. So you can do that on that fourth day if you prefer. The overall structure of the program remains very similar. So the style of the workouts remains very similar. It also includes the yoga, the recovery, and then again, that weight vest circuit is kind of the little change that we have in there. Um, and then, like I said earlier, you do get variety in terms of new exercises. You get instructions on how to progress your weights in the maintenance program. And then we have 3 tiers of the maintenance program. So if you're someone who is like very confident, you feel really good about just taking it and running with it on your own, that's our lower tier. So you get all of the programming, the progressions, and the information about progressing. And then that's your program. If you want a little bit more support, you would land in the middle tier, which includes everything from the first tier. Plus, you get a monthly office hour with rotating coaches. So that's where you get a little bit more community and some face to face time with coaches where you can just check in on form, questions about the programming, exercise selection, anything like that. And then we have our highest tier, which includes everything I've already mentioned. Plus, you get one on one interaction with your coach still. So, whoever you went through the program with, you stay with them because they know you. And then you get weekly check in, and they can supply up to 2 exercise modifications or swaps per month.
Perfect. Thanks so much. Um, yes, and to answer, somebody has questions about whether we give instruction on how to navigate the technology of the program. Yes, absolutely. We have a giant intro meeting that goes over all of that, and the intro week is partly so that you have a little buffer of time to get familiar with the technology, the platform, how everything works. That week is there to help you get settled in and really confident with everything as well. There's a couple of questions about Buff Bones, the Pilates based program, and OsteoStrong, and how they compare to what we do. I'm super happy to answer this question because both the Buff Bones program and OsteoStrong have actually been compared to resistance and impact training in very high quality studies, the Lift More trials. Both were found to be ineffective compared to resistance and impact training. That's kind of the long and short of it. Buff Bones is Pilates based, not progressive and not coach, which are really the key ingredients again for improving bone density. Good for general health, not an effective bone density intervention, as was discovered in the study. OsteoStrong, if you Google them, you will see that there are lots of studies claiming to show that OsteoStrong improves bone density. However, if you actually look a little bit more closely, you will see a significant number of red flags with those studies. The first one is that often the study was funded by OsteoStrong or an entity associated with OsteoStrong, which is a huge conflict of interest and should make you question the validity and quality of the data. The other issues is that these trials were not appropriately randomized or controlled or blinded, meaning people knew the intervention they were getting, which introduces an element of bias. They did not account for other factors that could alter their bone density. So, if somebody is also doing HRT, traditional resistance training, impact training, taking calcium and vitamin D, you cannot then say that OsteoStrong was the thing that improved their bone density. So the quality of the data is unfortunately very, very low. And big criticism that most clinicians and bone health experts have about OsteoStrong is that it massively underdoses the stimulus needed to improve bone density. It's just once or twice a week for a few minutes. And if I told you, for example, if you think about it this way, if you were training for a marathon and you went for 2 5-minute runs a week, that would not prepare you for the marathon because it is not enough stimulus to create the adaptation needed to run the marathon. And it's the same thing with this like tiny dose of the stimulus that the OsteoStrong protocol provides. So it's a significant underdosing, and it is not a movement program, which means you're not getting any of the functional benefits of doing a traditional resistance training program, which has a lot of carryover into your daily function. Michaela, is there anything you would like to add to that?
Yeah, I mean, you said you covered everything, but, I think that one of the biggest things too, again, is, like, this lack of the functional carryover, and then that low dose stimulus. And then it's not supported by BHOF either.
Yes, actually, so that's a really important part too, is that the BHOF actually explicitly states that they do not endorse the protocol, which should tell you should tell you a lot. Paula, you can see the cost of the maintenance programs in that link that I provided a second ago. Here it is again. Um, uh, and some people were asking about the time commitment of the program. And then, Irene, maybe you can sort of recap this a little bit, Michaela. Classes are planned to be an hour each day, 6 days a week for 12 weeks. Am I correct?
Yes, so so when it comes to the time commitment, in the first month of the program, give yourself more time than you think you might need because you're going to be getting used to the technology, the exercises, and all of that's going to take a little bit of extra time. So for the first month of the program, we recommend budgeting 90 minutes for the strength days. Those of you who are coming in with a little bit more movement background or strength experience might not need that full 90 minutes, but it's better to have it and get done sooner than you thought than to not have it and be butting up against a time limit there. So for the first month of the program, budget 90 minutes for your strength. And then throughout the entirety of the program, yoga is about 30 to 45 minutes. And then that recovery day is it could be anywhere from 5 to 10 minutes up to about 30-ish minutes, depending on how many of the modalities you decide to do that day. Once you get into phase 2 and 3, you're much more familiar with the exercises. This is the other benefit of letting them repeat themselves. You build up that familiarity and it builds efficiency as well. And you can usually finish that strength workout, depending on the person, between about 45 to 60 minutes. If you're someone who, is newer to strength training, you might want to budget closer to that 60 minutes or so. So it's going to be 6 days a week. 4 days of them are going to be about an hour. One day is about 30 to 40 minutes, and one day could be anywhere from 5 to 10 to 30 minutes.
Perfect. Thanks for providing that context there. A couple of questions related to modifications and individual needs. I have shoulder mobility problems, I think because I can't get my arm close to my ear overhead. Should I seek PT for improvement or can we work with where I'm at? I would say the latter. Strength training is also a good mobility protocol. So as you build more muscular strength in a wider range of motion, you are going to gain mobility as well. And we do have shoulder problems very frequently in our program with people, especially having difficulty with the overhead position. So this is something we're very used to working with as well. And Julie is saying that she would need to modify for her left hip replacement and right ACL replacement third time. No problem, right? So I would say yes. And both of those areas are going to benefit from building better muscular strength and stability as well. Again, those are things that we are extremely used to working with in our program. Everybody asking about the list of required gear. Let me see. Let me type the answer here. You can email our executive assistant, Juliana. And in fact, if you're signed up for our newsletter, you can hit her reply to any of those newsletters to ask. The answer will go straight to her. So it's here to help at kareprehab.com. Irene, I'm dropping it into as the answer to your question there. And you can always hit reply on any of our newsletters, any of our communications that you receive from us for those kinds of questions. Um, Paula had a great question. If we've been exercising for a little bit already, is the intro 13-week foundations progressive, tailorable to our level? Michaela.
I would say the material is going to remain the same no matter whether you're coming in with strength training background or not. But I think even people who have come into our program with pretty extensive strength training backgrounds have benefited from the intro week because it's really talking about strength training for osteoporosis. So it's a highly specific introduction. And then we also do include some things that maybe you haven't seen before, like the wrist strengthening exercises. And we have some resources for like overhead mobility. So that question just came up. So you'll still have things that you can really pull from. And then if you just take it again within this context of this is specific to how we strength train for osteoporosis, I think you'll still get a lot of benefit from that intro week.
Perfect. Thank you. And we are getting close to time, so we'll just answer one more question before wrapping it up. Somebody's asking if they take biphosphonate drugs already, can we have improvements with your exercises? Yes, if you want to throw the kitchen sink at it, then you will absolutely. If you're getting more of that bone building stimulus that is also targeted to the specific areas where you're having the most bone loss, then yes, absolutely, you will get more improvements. Not to mention, we keep coming back around to the functional benefits of a movement program that make you stronger, more mobile, more confident in your daily life. So, those are some of the other benefits. Like Michaela mentioned, fracture risk is a compound thing that includes more than just your bone density being the only factor that medications can address. So we also want to be working on your balance, your posture, your muscle mass, all of these things, your movement mechanics, your skill in being able to pick something up off the floor with that neutral spine, having the strength in the muscles of your back, your core, and your hips to stay balanced and do all of those movements skillfully as well. Um,
And
uh,
I just wanted to say too, if you take a look at our client testimonials and you look at Lori is the perfect example of throwing the kitchen sink at it, and she had really incredible results with doing our program in addition to medication and other supports as well.
Yes, absolutely. That's the perfect example. I'm gonna drop the uh, consultation link here as well. So Julie's asking, she's trying to figure out when to start. Can she talk or message with someone one on one about how to figure this out? Yes, you can book a free consultation with Michaela or myself. I'm gonna put the link in there for you. Anybody else can grab it as well. Um, Here you go. Perfect. All right. And there's always some questions that we unfortunately don't get to. But I want to reiterate again that if you are signed up to our newsletter, hitting reply on any of those is going to get you directly in touch with our executive assistant, Juliana, or a member of the team if Juliana is not able to answer your specific question. So we're here to provide all the assistance and the resources that we can. I also wanted to mention, like we said at the beginning, that we are going to email out a recording of the session to everybody that registered. However, when you got the event information, we did ask you to opt in to hear from us, which is the only way that we can legally contact you without with the webinar recording. So if you did not opt in or you're unsure if you opted in, please email here to help at kariprehab.com and we can get you signed up for the newsletter if you'd like to receive that recording. We also have all kinds of other events coming up that might be interesting and helpful for you. Just to give you a little bit of an idea, we have our Meet the Experts session, which is an open Zoom office hour with myself, Michaela, a few members of our team, our coaching staff, so you can meet them and get to know them and get a feel for the style of coaching that you receive in the program and have your questions answered. So we have our Meet the Experts session on October 15th. That's next Wednesday. We have another World Osteoporosis Day webinar on the 25th, also in collaboration with the Bone Health and Osteoporosis Foundation. That one is going to be presented by Karen Weinstein, and it is about the research backed exercise modalities that work or don't work. So, all these questions about the vibration plates, the Meridyne, walking, things like that. If you want really clear evidence-based answers on like what works and what doesn't, this webinar is for you, and you'll get that via our newsletter as well. Then we have another seminar about our strength training and yoga for osteoporosis program on November 22nd. So my point is we do lots and lots of things to help you get more educated and to find out more about exercising safely and effectively for bone density. You hear about all of that in our newsletter. So if you're unsure, yes, Marcia, here to help at Kari Prehab. Here, let me type that in. There we go. Here to help at kariprehab.com. So, yes, and you can also get in touch with us. Going to our website is a really easy way to get signed up for the newsletter as well. Just click any of the buttons and fill out your email address, and you will be signed up for our newsletter and hear about all of these events coming up as well. Michaela, thank you so much for being here. Any final words of wisdom for everybody here?
No, just thank you so much for your time. I love answering all these questions, and it's really fun to get to be here and hopefully provide some answers and clarity for your next step forward. And like Genny said, if you need anything, we love to connect with the people that we work with. So please just reach out, and we're happy to help.
Yeah, and if all else fails, find us on Instagram and send us a DM there. Go to our website and click any of the buttons there. So lots of ways to get in touch with us. And we hope to see some of you online in the future at one of our events or maybe in our next group starting on October 22nd. Our program start dates are also always published right at the top of our website. So you can find all the information there and the next steps to get registered or enrolled if you'd like to join. We appreciate all of you taking time out of your weekend to come hang out with us and spend a little bit of time with us. We appreciate your engagement and your insightful questions. Thanks so much for being here and have a great rest of your weekend. We will see you soon somewhere. Thanks very much. Bye.
Thanks, everybody.